In this video, we will discuss OASIS navigation. This video will show users how to use a keyboard or mouse to maneuver through the new OASIS layout. Users should have the ability to enter in patient demographic information, patient intake records, be familiar with creating status records, and also generating the OASIS within the status record. With the new OASIS C being implemented, the healthcare assistant now has a new OASIS interface. The keyboard can now be used for majority of the data entry along with the mouse. The OASIS questions are now grouped in a tree format for easy navigation. Also, validations and audits can be viewed from within the OASIS record without having to save and close the OASIS first. With the new integration of keyboard controls, the main buttons that will be used are Tab, Page Up, Page Down, the arrow keys, and the spacebar. There will be other buttons used as well, but we will cover those later in the video. Note that each user's keyboard may be slightly different from the diagram shown. Once inside of the OASIS record, users can move forward using the Tab key. If users wish to move backward, pressing Tab and holding down the Shift key will allow them to do so. To select a response for questions that have a checkbox, the spacebar can be used to place a checkmark in the desired response to the question. The spacebar can also be used to deselect a response to a question. Once a user is finished with a group of questions, the Page Down key can be used to move to the next group in the tree. To navigate back to a previous group of questions, the Page Up key can be used to perform this action. The arrow keys are used to select answers for questions that have radio button responses or bubbles. To deselect a response, the user would have to press the Clear button for the corresponding question. To jump to a specific question in the OASIS, users can press Ctrl and the M key simultaneously to move the cursor to that field. Then the user can type in the specific M code question or use the up and down arrow keys to select the specific question. Pressing Ctrl and the A key simultaneously will bring users to the Assessor field. This field will allow users to select the caregiver who had originally completed the assessment. The users can type in the caregiver code, caregiver's last name, or use the up and down arrow keys to navigate through the list. With the new layout, users can now validate the OASIS at any time by selecting the Validate button. This will show the current validation errors for that OASIS without having to exit from the record and read the OASIS errors report. The grouper validation errors are now specific to where the problem lies. For example, if a code is invalid, the code will show in red and the warning message will let users know which code is no longer valid. Users can also view any OASIS consistency audits by selecting the OASIS Audits tab. Note that the Home Health Gold edits must be activated by a registration code from Healthcare Synergy. To save or exit the OASIS at any time, users can select the Save or Exit buttons on the bottom right. If there are no longer any validation errors, the program will allow you to save the assessment and it will exit automatically. If Exit is selected prior to saving, the program will ask you if you would like to first save the OASIS before exiting. If you select Yes and there are no longer any errors, the program will save and exit the OASIS record. For review, the new OASIS interface allows for complete keyboard navigation. Users can now validate and view the validation errors of the OASIS at any time without having to exit the OASIS first. And also, the mouse can still be used to navigate and select responses to OASIS questions.